Bismillah ar-Rahman ar-Rahim. We will continue our second lecture about oncology by having certain definitions that we should know. Hypertrophy is an increase in the size of the organ without increase in the cell number. Hyperplasia is an increase in the size of the organ due to the increase in the cell numbers. Metaplasia is the change of the type of epithelium from which the tumor arises from. For example, there will be change of transitional cell epithelium to squamous epithelium in urinary bladder. In our country, in the south, because of the prevalence of the schistosoma hematobium infestation, bilharziasis, the ova of the bilharzial ova, it will be implanted in the mucosa of the bladder, resulting in chronic irritation. And chronic irritation by itself, it changes the transitional cell epithelium into squamous one, and the patient will develop squamous cell carcinoma of the bladder. While areas where there is no bilharziasis, if the patient will develop carcinoma of the bladder, they will have transitional cell carcinoma of the bladder. Dysplasia is the earliest change of neoplastic transformation that can be detected at a microstructural level, let's say at the level of light microscope, where the cell, it will change its shape and size and intracellular organization and intracellular three-dimensional organization. These changes it will precede the development of an invasive cancer. These genetic mutations which occur in the cell can cause a change in the morphological features of the cell, and this will appear as dysplastic changes in the morphology of the cell. These morphological changes, it can be mild or moderate, and it can be severe. The mild and moderate changes, it can revert back to normal if you are removing the initiating factor that it causes these changes. But in severe cases, there is least likely that this type of dysplasia, it go back to normal if you remove the initiating factor for its development. Genotype is the molecular structure of any cell, and in malignant cells there is what they call it malignant genotype, is the molecular structure of a malignant cell in the presence of oncogene and loss or mutation of the tumor suppressor gene. The phenotype is the appearance of the cell either at a microscopical structure level, like in cases of microscopical phenotype, or its functional state of the cell. We call it biological phenotype, where the cells, it will express its secretion and its function. A change in genotype almost always precede the changes in phenotype. So normally appearing cells can have a malignant genotype, and the phenotypic changes which occur in a malignant cell, it will follow the appearance of the malignant genotype. What is screening? The screening is an examination of asymptomatic population at the risk of a particular condition with a view to early diagnose and treat such conditions with subsequent increase in the cure rate. For example, carcinoma of the stomach is common in Japan, and those patients, so they will undergo screening programs by the Japanese government to detect the early cases by doing screening, endoscopy, and taking biopsies, 8 to 10 biopsies from random areas of the stomach of people who are exposed to such risk, without the presence of any symptom. So they will detect the carcinoma of the breast as at an in situ level. And in situ carcinoma had about 90 to 100 a cure rate if you treat such patients. Differentiation is the degree of resemblance of malignant cell from the cell where it originated from. This could be divided into well-differentiated tumor, where the degree of resemblance is about 75 to 100%, and moderately differentiated tumor, where the resemblance between the malignant cell and the normal cell is about 50 to 75%, and poorly differentiated cells, where the differentiation is between 25 and 50% of the cell. While complete loss of differentiation or very low rate of differentiation to occur when the tumor cell resemblance is about 0 to 25% of cell. And there is complete loss of differentiation. It can occur in cells which are undergo malignant changes, where the tumor will become very aggressive type of a tumor. What is teratoma? Teratoma is a tumor which arises from embryonic stem cells, which contain the whole representative 3 layers of the embryonic layers, which including the ectoderm, the mesoderm, and endoderm. And the dermoid cyst is the best example of the teratomas, and it contains the hair and the neural tissue arises from the ectoderm. It might contain teeth and cartilage and muscle, which usually develop from the mesoderm, and the glandular tissues, which are a derivative of the endoderm. The blastomas are tumors that arise from any one of the 3 embryonic layers. It should be one of the 3 embryonic layers only, and is in cases of neuroblastoma, retinoblastoma, and medulloblastomas. The biology of malignant cells differ from a normal cell in a variety of ways. These might include morphological differences. The malignant cell differ from the normal cell morphologically as it undergo polymorphism, that say they have different shape and sizes, and hyperchromatism, where it takes the stain more than the normal cell on staining program during histopathological examination, and the high index of mitotic figure, where we can see a lot of cells at the stage of mitosis which cannot be seen by the normal examination of a normal cell, a normal cellular normal cell at normal tissues. Biochemically, the cells, they have the same biological activities as in malignant cell, apart from the differences in the DNA and RNA structure. There are certain biological changes which occur in a malignant cell. The first one is the loss of contact inhibition, where the cell, once it will proliferate into 2 cells, the contact between the cell will try to suppress the process of proliferation, and this is completely lost in cases of malignant cells. Also, the malignant cell, it is less cohesive to the nearby cell, and that's why they will shed from the site of the tumors, and these cells which are shedded into the tissue fluid will pass through the lymphatic channels and in the veins, and it will metastasize by lymphatic or by bloodstream. The cell undergo dedifferentiation, and they will return back to its embryonic state, so it expresses the normally present fetal genes, which are suppressed during the process of differentiation of these cells. So this fetal antigen, it will appear on the surface of malignant cell, as in cases of carcinoembryonic antigen, or it is secreted into the blood, and the carcinoembryonic antigen it can be detected in carcinoma of the colon and GI tumors. And alpha fetoprotein, which is present on the fetal cells of the liver and in the testis, so it can be detected in hepatomas as well as in germ cell tumor of the testis. There will be excessive secretion of substances that are normally secreted by the normal cell. As we know that the malignant cell have a very high metabolic activity, so they will secrete these hormones larger than or greater than the secretion of a normal cell. And this occurs in cases of medullary carcinoma, where it arises from the C cell, the calcitonin secreting cells, where the calcitonin is secreted in a large amount, and it can be detected in the blood of patients with a medullary carcinoma, and it can be regarded as a tumor marker. And the serotonin, which is usually secreted by argentaphin cells, and if the patient develop argentaphinoma or carcinoid tumor, the serotonin level in the blood, it will increase, resulting into increase its level. And once it is detected, it can be regarded as a tumor marker. Catecholamines in adrenomedullary tumor is also increased, and it can be detected in the urine of the patient with with pheochromocytoma, and this is regarded also as a diagnostic test for the pheochromocytoma. And cortisol level is also increased in cases of adrenocortical tumors, resulting in the appearance of features of Cushing syndrome. These cells, once they undergo dedifferentiation, there will be expression of suppressed genes. So certain cells, certain tumor will secrete substances and hormones that it cannot be secreted by the cells from which they originate. For example, in carcinoma of the bronchus, where the patient will secrete parathormone, ACTH, as well as ADH hormone, and all of them, they will produce certain clinical features. The parathormone is secreted usually by parathyroid hormone, parathyroid gland, and the ACTH and adrenal ADH is produced by the pituitary gland. Some tumors remains localized and encapsulated for a time for a time, and then an example of that is a carcinoma in situ in the ovary and the breast, but in turn, with after a lapse of time, these malignant cells, it will go and metastasize or invade the locally in the tissues. The differences between benign and malignant neoplasms at a macrostructural level, at the say grossly, the size of the tumor is usually small in benign and large in malignant. The growth characteristic is slow in benign and rapid in malignant tumors. The vascularity is normal or slightly increased in benign tumors, while it is increased in cases of malignancy. The function is not affected where the organ is involved by benign tumors in most cases, except the brain tumors, as we said, while the function is affected in most cases in cases of malignant tumors. Invasion and metastasis usually doesn't occur in cases of benign lesion, while it is one of the characteristic features of the malignant tumors. At the microstructural level, the differences include nuclear variation in size and shape is minimal, while the nuclear variation in size and shape, it will be marked in cases of neoplasm. Diploid cells are present in benign lesion, while there is a range of ploidy present in malignant cell. Low mitotic figures are present in benign tumors, and high mitotic count and mitotic figures is seen in a malignant lesion. Retention of a specialization will occur and preserved in benign tumors, while there is loss of a specialization of the cell in a malignant tumor. The structural differentiation is present and retained in benign tumor, while the structural differentiation show wide range of changes from well-differentiated to undifferentiated cells. The method of spread of a tumor, it can be one of the following. The first one is the lymphatic spread. The cells will shed and it goes through the lymphatic channels into the nearby lymph nodes, and there's examples of carcinoma of the breast and carcinoma of the stomach is one of the examples for lymphatic spread. Hematological spread or hematogenic spread. Usually, the malignant tumor, it will shed and enter the veins, and it can go to a distant sites from the site of its origin, as in carcinoma of the breast. It goes to the dorsal spine through the intervertebral venous plexuses. Between the internal and external venous plexuses, there is communication, so it goes to the body of the vertebrae and causes secondary metastasis in the dorsal spine. Hypernephroma through the renal vein, it will pass and it goes to the bone, resulting in into a pathological fracture of the bone. Direct invasion of the nearby structures, it can occur in most malignant conditions, but the best example for local invasion, which occur alone and doesn't metastasize the basal cell carcinoma or rodent ulcer, where it extends from one side and heal from the other side, producing a sign of fire in the field, and very characteristic. It has a very characteristic raised edge and occur in the area near the area of nose and the angle of the mouth. The other type of metastasis, or the other mean of metastasis, is what call it transcoelomic spread. Carcinoma of the stomach, it can shed its cells into the coelomic cavity, into the peritoneal cavity, where it passes to the pelvis, and it implants these cells into the ovaries, and the tumor develop on both sides, and both ovaries are affected. And this type of a tumor are called very characteristic type of tumors called Krukenberg tumor, well-known secondary tumor in the ovary from carcinoma of the stomach. The general symptoms and signs of tumor can be produced by either a primary tumor itself or by metastasis, or there are certain systemic manifestation of the tumor without metastasis, and we will see what are these changes or what are these manifestations, and the tumor can be discovered incidentally during checkup for another cause like chest x-ray or a general examination of the patient, and usually such patients are asymptomatic. The primary tumor will affect the tissues either by appearance of primary tumor. It can be detected either by appearing of palpable swelling, and the palpable swelling usually they are painless, and it invades the local structure, but it doesn't cause pain. But if it invades certain structures like the neural plexuses, it can produce pain, as in cases of breast cancer, which cause brachialgia, and thyroid, which involve the nerve, causing hoarseness of the voice, or the stomach, resulting in secondaries in the it causes a mass in the appearance, a palpable mass in the epigastric area. The tubular structures, when a tumor occurs in the tubular structure, it causes obstruction of this tubular structure, whether it is a luminal structure, just like the esophagus, and resulting in dysphagia, and obstructive jaundice, causing obstruction of the vein, and large bowel obstruction, as in cases of obstructive jaundice, as in obstruction of the common bile duct, or a large bowel obstruction, as in colonic tumors, and the development of gastric tumor resulting in vomiting. Bleeding, it can be overt, it can be seen by eye in hematemesis and carcinoma of the stomach, hematuria and renal cell carcinoma, and rectal bleeding in cases of rectal carcinoma. And it can result in occult type of bleeding, as in carcinoma of the stomach, resulting in anemia, and also in cecal carcinoma, where they will present with anemia, asthenia, and anorexia. Symptoms of compression or invasion of local structure, it can also occur apart from the obstruction of the luminal structure, including superior vena cava obstruction and in cases of bronchogenic carcinoma. And the backache in carcinoma of the pancreas is a well-known type of pain. Facial nerve palsy, it can occur in parotid tumor and recurrent laryngine nerve palsy in cases of thyroid malignancy. The metastasis can produce symptoms and manifestations like palpable lymph node or enlarged lymph nodes, which occur usually if they are multiple and hard and matted together and fixed. And this patient, these lymph nodes, it can give you an idea from where it originated from by examination of the lymphatic field for each lymph node in the body. The liver is also affected by metastasis and resulting in hepatoma, where the liver on palpation shows multiple masses due to secondaries, and the secondaries usually arising from the GI tract, including the stomach, the colon, but it can also occur from the breast and from the bronchus. Jaundice due to enlarged lymph node in the porta hepatis is due to primary in the stomach and pancreas and colon. And the ascites are the presence of fluid in the peritoneal cavity, which can be detected by transmitted thyroid shifting dullness. It occurs in ovarian as well as in GI malignancies. The patient might develop abdominal masses, as in cases of carcinoma of the carcinoma of the stomach, which invade or causes omental secondaries, and also abdominal mass can be seen with the with omental metastasis. A fluid will be retained in the peritoneal cavity and causing ascites. Bone metastasis can result in pathological fractures like in breast cancer, thyroid, bronchus, renal, and prostatic carcinomas. Pleural effusion, it can be due to bronchogenic carcinoma, and it also can occur in breast cancer if it invades the chest wall. Brain tumors, secondary to malignancy can result in convulsion and confusion and personality changes, and usually it occurs due to bronchogenic carcinoma, breast cancer, and also a malignant melanoma. There are certain manifestations which are not related to metastasis. The first one is cachexia, or the severe weight loss. This severe weight loss, it can occur due to the tumor factory where it needs substrate, so it will try to break down the proteins and fat and and tissues, so that you will have substrate for formation of a new tumor cells, and the patient will go into state of severe cachexia and severe weight loss. Pyrexia of an origin, it is one of the features of lymphoma and hypernephroma. Clubbing of fingers in bronchogenic carcinoma, and very characteristic feature of pancreatic tumor, which is called superficial thrombophlebitis migrans, where there will be thrombosis of the superficial veins at different sites, one in the hand, on the other side in the lower limb, or in the back, or at whatever it will be the site of the vein. Neuropathies and myopathies are a common feature in carcinoma of the bronchus. Endocrine manifestation include secretion of ADH, antidiuretic hormone, adrenocorticotropic hormones, as in cases of bronchogenic carcinoma, and also parathormone hormone, which is secreted by bronchogenic tumors in the lung. The diagnosis, it can be diagnosed incidentally in asymptomatic patients by examination of the axillary nodes. You can find a small lymph node, and if you examine the breast, you can find a very small mass that it cannot be detected by breast self-examination, which have been done by the patient. And the other one is the silent pulmonary metastasis, whether it is in cases of bronchogenic carcinoma or secondaries metastasis to the lung from other areas, including the bronchogenic carcinoma or breast cancer or whatever it will be the tumor. Thank you very much for your listening. If there is any question, we are ready to answer the question.